Hi, it's Dr. Nami again, and I wanted to share with you a couple of great results and some really fun things that we've had a chance to do. I wanted to share a story about my patient Stephanie. She is a lovely, really busy gal, doing a lot of good work and just super busy, mid 40s, and just really wanting to take better care of herself, especially in the next couple of years. We know there's hormonal changes, there is lifestyle changes. And we're just no longer spraying chickens like we used to be. So really, she really came in because she wanted to have confidence in her health and really make sure that she was taking really good care of herself. So she came into the office. We looked at a few things, and she was really nervous because it'd been some time she's gone to a dentist, like 5 years. They said, you know what? Don't worry about it. It's okay. Let's take a look and see what we can do to help you. So I'm going to share her results. So let's go ahead and talk about Stephanie for a second. So we did her oral microbiome, and you can see that this is her results when we first started. She had a lot of green light, yellow light, and red light bacteria. So she had these bacteria. Obviously, these are the ones that I'm most concerned about because they're linked to heart attack, diabetes, cancer, and Alzheimer's. And that with her, I customize all of my care. So I really look at how do I want to treat my patients. When I see something like this, and I look at the age range, I look at the genetic risk for inflammation or genetic risk for disease. In this case, she was really concerned about diabetes. Grandma had diabetes. She's on the verge of diabetes, almost pre-diabetic at this point. So we decided to say, let's go ahead and clean all of this up with like a deep cleaning with laser and our protocol that when we do it. So we did that for her, and through multiple appointments. This is her results. We retested her 6 weeks later just to make sure that we know with a vote of confidence what she's looking like. So what we did is we noticed there's a 77% reduction in the bacteria. This is gone, this is gone, this is gone. This is still there, but it's okay. We do want some bacteria to be there. This is completely gone. This is completely gone. This is decreased. This is completely gone. And this is decreased as well. So in this situation like this, or not in this situation, any situation, we're not looking for perfection. We're looking for progress. The number one thing that we're looking for is to get rid of these red light bacteria. You do want some of these yellow light bacteria because they are part of your microbiome. They do help keep things in balance. We just don't want a lot of them, meaning we don't want them to go above the thresholds. And if we have them in small amounts, we're able to take care of it with oral probiotics and routine maintenance visits. And we do double check everything every year just to make sure that you're on point, things are working well, and you have the total confidence that everything is working well for you. Here she goes right over here, giving us a 5-star review. She's like, Dr. Patel is amazing after my laser therapy. The games feel so much better. And obviously she feels like she's at the spa. And what's been really exciting actually to share about her is that not only does she smile more often, not she feels more confident in her health. She started dating again, has lost 10 pounds. So it's really nice to see what a positive impact it can have on our health when we take care of ourselves. And we hear this day in and day out, but to actually implement it is pretty phenomenal. And to be able to reduce bacteria with confidence, 77% without any antibiotics, without any injections, like this is wonderful to be able to see and super comfortable, really. So I'm really excited to share about Stephanie, and I'm really excited to show you the befores and afters, and some data, which really gives you a good idea of what's possible for you. So give us a call and let's see what we can do to help you.